Heart bypass surgery is a type of treatment for people who have narrowings in their coronary arteries. In a way, it's just like sorting out problems with getting through Kingston. You build the Kingston bypass. And what we do is to build bypasses around blockages in the coronary arteries so that more blood gets downstream. If you haven't got enough blood, you get pain. If you have enough blood, you don't get pain. So it's a fantastic treatment for people with angina. And there are certain settings where people's life expectancy is reduced because of the disease they have. And surgery can push your life expectancy back up again. So we do it for two reasons: for symptoms and to make people live longer. Bypass surgery involves the use of a heart-lung machine, and that is that to do the operation, we stop the heart because we're operating on very small arteries that need fine control to suture to them. And we have to breathe for the patient because we stop their lungs. So we connect the patients up and prepare for surgery by getting tubing, lengths of tubing that will make the bypasses. The surgery then uses those lengths of tubing to connect upstream and downstream of the problem. And then at the end of it, the heart has a normal blood supply with all the bypasses there. And we can then wean the machine off and the heart takes over, and that's the operation done. So the heart is almost ready to go home then, but the size of the procedure means it takes 5 or 6 days to get better, to get your strength back, to get mobilized, and to get your confidence, and for us to sort any niggles that come after the operation, to sort pain relief, mobility, etc. So you can expect by about 5 or 6 days to be mobile enough to go home with no support other than a relative to pamper you a bit. Heart bypass surgery is done principally for symptoms. And so if you come in with bad angina that's limiting what you can do, bypass surgery will change that. Bypass surgery will give you back your life again. And in my experience, there are two sorts of people. There are those that say, right, I'm on my second life and I'm going to retire, I'm going to look after me. And there are others who say, thank you for giving me the freedom to do what I always wanted to do. And now I'm going back to work, I'm going back to the gym, I'm going to be my old self again. After bypass surgery, what you can expect is to be in intensive care for one night, and you'll wake up during the evening after your operation. The second day is a level of care down called high dependency, where you aren't prodded and poked quite as much, but there's still quite an intensive group of people looking after you. And day 3, hopefully you'll go back to the ward, and hopefully most of the drains and the tubes and the catheters will all be out. You then start mobilizing in your room on day 3, in the corridor on day 4, up and down stairs on day 5, and then day 6. Hopefully, you'll be able to go home. You should be fairly independent. Your breathing should be back to normal. Your pain relief should be nothing more than paracetamol usually. And you then start to build. So you walk to the end of the garden, you walk to the end of the road, you walk to the corner shop, and you build it all up. And usually by 6 weeks, you're walking unlimited. By 10 weeks, you're back to your old self and the operation's behind you.